And that's what I like to see as you present it to children too, is they're all musicians. They all have that potential to follow that rhythm, to follow that beat.
I think when people hear music, they think that you have to have a background in music or that you have to be a music therapist. I personally don't have a background in music.
I just think it was definitely just a wonderful experience going to the training and how we've been able to implement it within our programs.
But actually taking the percussion intervention and honing in on student individual needs, I think that's the key.
St. Francis University's Center of Excellence for Remote and Medically Underserved Areas, CERMUSA, is proud to offer percussion intervention training with Jim Donovan.
What I love about doing these trainings is seeing someone come in who feels like they might not have what it takes to do a percussion intervention, and to quickly realize not only how easy it is to do, but how much it can help someone.
Percussion Intervention Training with Jim Donovan is a one-day, research-based training session designed to empower anyone to use simple yet highly effective percussion interventions to improve quality of life for children with disabilities. This training requires no musical or teaching experience. You will not need to know how to read musical notation, nor will you need a background in music theory. This program is designed to take you as you are and give you the skill sets you need to begin creating your own rhythm-based interventions. These sessions are facilitated by renowned musician and percussion facilitator Jim Donovan, award-winning founding member of the multi-platinum band Rusted Root, and are based on CERMUSA's published applied research studies. A percussion or rhythm intervention is a technique that uses easy-to-learn percussion approaches, instruments, and methods as a way to elicit a desired behavioral response, such as maintaining attention to task, improving socialization skills, or increasing the ability to communicate. Examples of percussion interventions include, but are not limited to, teaching a child to spell his or her name by associating it with a specific rhythm.
1, 2, 3, go.
Providing a child with a shaker or other percussion instrument that allows the child to maintain attention or focus in noisy or distracting environments.
Look at me. We're going to count to 10. Ready? 1, 2, 3, 4. Hey, now you come up.
Providing a child with an acceptable mechanism to release energy, such as striking a drum.
Very good. Very good.
This session will reveal ways to help and empower children with disabilities by engaging them with rhythm and sound. During the training, participants will learn the skills, concepts, and philosophical foundations to assist in performing meaningful, effective, and successful interventions with individuals with special needs. Facilitator Jim Donovan explains how the program works.
Percussion intervention training combines hands-on and theoretical learning. Within the first hour of the session, participants will be creating music and exploring the methodologies of percussion interventions. The training makes use of fundamental, inexpensive percussion tools such as egg shakers, sound shapes, and boom whackers. Instruction is provided on how to use rhythm as a way of focusing attention, encouraging desirable behaviors, improving communication skills, and promoting socialization. Upon completion of the training, participants receive a certificate of completion indicating that all program requirements have been fulfilled.
Well, to be honest, I was initially very skeptical of the training. One of the things I do a lot of training with our own agency about is scientifically unsupported therapies. I spent a lot of time talking about their use and misuse, and I was reluctant at the start, but because my colleagues, Troy Klein and Brian Nagel, seemed so enthusiastic about it, I thought I would give it a try. And upon arrival and participating in it, I completely changed my viewpoints around the program.
Percussion Intervention Training with Jim Donovan was developed as an extension of research conducted by St. Francis University's CERMUSA. During a 12-week study, occupational therapists and occupational therapy assistants working within school districts in 7 Pennsylvania counties were trained to use percussion interventions with children with autism.
My favorite part about the training is the creativity, and as you watch the therapists go through the training, you see the light bulbs go on with how this percussion can be used. In the last training, we had presented case studies to the students, and It really made them think about how they could best utilize percussion with their potential patients. We were so impressed as a faculty that we intend to incorporate the training on an annual basis with our occupational therapy students.
These professionals used the percussion intervention to increase the time students with autism were able to maintain attention to task. By the end of the study, participants demonstrated an average increase in attention to task of 189%, with outliers as high as 400% or greater. These results have been published in Exceptional Parent magazine and in Telemedicine and eHealth, a leading international peer-reviewed journal covering the advances and clinical applications of telemedicine.
I would tell them that you walk into the training and you might be a little bit nervous about what you're going to do if you're not musically inclined. And I think it helped me realize, you're not pinned down to this is my goal, that's my activity. You can be a little bit more creative and add some new things into your therapy ideas or your therapy techniques.
Percussion Intervention Training with Jim Donovan is available for your company or institution as an in-person group session or at a distance via video teleconference. CERMUSA can also provide facilities for in-person training at the scenic St. Francis University campus in Loretto, Pennsylvania. Currently, 2 levels of percussion intervention certification are available. Level 1, Individual Child Intervention, and Level 2, Group Intervention. In addition, CERMUSA also provides a limited number of sessions to the general public several times per year. To schedule a session or for additional information, please contact Brenda Guzik at area code 814-472-3389 or email her at bguzik@cermusa.francis.edu or visit www.percussioninterventiontraining.com.